Hi, my name is Pallavi Prasad and this is the newsworthy COVID-19 bulletin you're looking for. For a change, there's some good news. India continues to register fewer and fewer new cases every day despite not losing sight of extensive testing. For 3 straight weeks now, more people are recovering daily than new cases are being registered. And India has the highest number of recoveries in the world now. For the first time in weeks, the number of actively sick patients has also fallen below 9 lakh. In mid-September, this number was over 10.17 lakh. That's satisfying, deeply satisfying. But Dr. Randeep Guleria, the director of AIIMS, has a caveat. These trends have to continue for at least 2 more weeks before we can say that India is past the COVID-19 peak. The challenges, the upcoming festive season and the winter months in which respiratory illnesses largely show a spike. When asked pointedly about Delhi, which is looking at weeks of smoke and fog, Dr. Guleria said that winter and air pollution could lead to a spike in COVID-19 cases. More specifically, he said that a 1-point increase in air pollutant PM 2.5 can lead to a 6 to 9% rise in the number of COVID cases. And a separate report by the National Center for Disease Control has also suggested that Delhi should brace for 15,000 new infections daily during the winter. So this is not the time to lower our guards. Dr. Guleria has handy advice. Act like you are COVID positive and treat everyone as if they are COVID positive. And while we do that, scientists are hard at work. At least 2 vaccine frontrunners, Pfizer and Moderna, are set to release results of their late-stage trials this month. 7 other vaccine candidates are in final stage trials across the world. And in India, 2 vaccines are in phase 2 trials and the one by Oxford University is in phase 3 trials. The Health Ministry has said that it expects supplies of the Oxford candidate to be available from January next year. Now, generally, politicians and drug makers are more ambitious than scientists. While the former group believes a vaccine is a real possibility by the end of this year or January, the experts say that vaccines are likely to reach the general public in March or April of 2021. Because you simply can't rush science. Globally, over 86 lakh people are actively fighting the virus as we speak. Europe is still on high alert, carefully monitoring a spike in cases. America remains the worst hit, with the president claiming he no longer has COVID-19. The White House refuses to confirm that. And from what it looks like, Trump is gearing up to rejoin the campaign trail. He keeps on saying on Fox News and on Twitter that he's immune to COVID-19, that he can't give it or get it, that he can go way out of the basement. Now, Twitter flagged all of this for misinformation because that's exactly what it is. And China, on the other side of the world, has claimed that the coronavirus broke out in various parts of the world last year, but that it was the first and the only one to have reported it and acted. That refutes the widely held view that the deadly contagion originated in Wuhan. Now, I can't speak for the veracity of either claim, but what I do know is that over the past months, we have seen several reports and studies coming out of Europe and America, where doctors and scientists have found proof of the novel coronavirus existing in their countries as early as November 2019. I'll stop here for today. If you've been listening, thank you so much for your time.